I think it's a really big mistake to talk about putting a whole lot of new money into the healthcare system without being very specific about how you're going to get costs down. You know, electronic medical records, the RAND Corporation says, will save us $80 billion a year. The Best Practices Institute, which would have comparative effectiveness, would save us billions of dollars. You know, just this recent article about how the old diabetes drugs are just as good or better than the new blockbuster diabetes drugs. We could save billions of dollars if we reined in the pharma companies and their, you know, cheerleader and, you know, football star drug sales people and had a really solid base of clinical evidence. And I want a public-private partnership in what I call the Best Practices Institute to do that. So we can get costs down. Then I'll be giving a speech in a couple of weeks about how we get quality up for everybody. Because the other thing you run into when you start talking about universal health care is that people who are already insured, they get bombarded by the insurance companies and the pharmaceutical companies and some doctors groups all saying, oh, you know, universal health care, that means your quality is going down. You know, you're going to wait months to get your appointment. It's going to be like what happened at Walter Reed with our soldiers. If a returning Iraqi veteran who is wounded cannot be treated in a timely fashion with respect and dignity, you think you'll be treated in universal health care? And it's worked since Truman. I mean, it's been very effective. So we've got to say, look, we're going to get quality up from everybody in the following ways. And I'll be giving a speech about that. And then finally, I'll talk about coverage, but I think it's really important to recognize that this is not about a plan. It is about the political will and the strength of the coalition you put behind the concept of moving toward universal health care coverage and whether they'll stay with you or they'll fold. Because in 93 and 94, I had so many people sign on the dotted line who were going to stay with me, and then they started getting pressed by all kinds of other forces, and they all peeled off. So this time, you know, we're going to go into this together. We're all going to be holding hands when we jump off the bridge.